past several years, there have been several incidents of pandemics arising from seasonal flu and mosquito-spread diseases. In addition, lifestyle diseases have become a major concern. A peer-reviewed study, for example, argued that the 2006 dengue epidemic in India costed around $27.4 million to the economy. A similar study on the spread of swine flu across North India in 2015 highlighted how the disease had affected productivity of the economically productive age group, which is 30 to 45 years and 45 to 60 years. The Indian economy's outlook towards the healthcare sector has remained abysmal, with only about 1% of its GDP on public health, among the world's lowest. We asked a senior commentator on the potential risks which the corporate sector can face due to the inadequacy of addressing the health hazards.
This is highly inadequate in terms of providing the nature of health services that India, and particularly with its growing population, needs. Obviously, many health services suffer as a result. While there has been considerable focus and some progress in the area of maternal and child health and infectious disease control, now a whole host of new infections are springing up and are threatening in terms of their rapid spread, potential rapid spread. And there are several non-communicable diseases like cardiovascular diseases, diabetes, cancers, and mental illness, which have now emerged right at the top of the disease burden list. So we have problems both of the past underdevelopment as well as of maladapted modernity combining together to threaten India's health and therefore India's security.
To understand these challenges further, India Risk Report will today look at the healthcare sector of India, the corporate response to these threats, and the roadmap to where the future of well-being for the employees and the economy will be heading.
Hello and welcome to another episode of India Risk Report, and in this episode we are looking at how to address the risks that come to a society through pandemics and the various challenges that India faces in terms of the medical facilities that India can provide and what are the expectations of the Indian population. For instance, India spends only about 1% of its GDP on public health, and which is amongst the world's lowest. But at the same time, if it doesn't spend more, it could be looking at catastrophic challenges which would be very, very difficult to then contain because it will require a lot more money. And also, there are 76% of Indians who do not have any health insurance. Now that may begin to change with the new budget that the government has just presented, but overall India needs to continue to pump in a lot more money if it is to come anywhere near achieving the target of providing health and safety standards for its citizens. And we have two informed experts who are going to throw light on the subject. We have Colonel Vineet Sehgal, who's who's just joined IRIS as Vice President of Risk and Business Resilience, and comes in with a lot of experience in the corporate sector, having worked with some big names like Genpact. And we have with us Ramanan Lakshmi Narayanan, who is a senior research scholar at Princeton and obviously a man who has been looking at some of these things in terms of diseases in very great detail, as good universities and Ivy League universities expect you to do. So I'll start with you. Where do you think really there is the disconnect between what the challenges are in India and what India has been doing? Because one of the things that I have come across is that though the figures appear rather dismal for India when you look at it overall, but if you look at the kind of expenditure that we are seeing in the private sector and private healthcare business, it is actually going up pretty dramatically. But it's the guys who cannot afford private healthcare who are left to the mercies of the challenges that nature throws on us. What's your take?
So let's start with a bit of context. This year is the 100th anniversary of the 1918 flu pandemic, often mistakenly called the Spanish flu, although it was called the Spanish flu only because the King of Spain got the flu. It actually probably started somewhere in the Midwest of the United States. Killed about 100 million people at the time when the world's population was less than half of what it is today. Right. So if such an event were to recur today, The speed of travel is much greater. Contact between people is certainly a lot faster. It may not be greater, but certainly is a lot faster. And certainly it is not clear that the health systems today are prepared to take on that kind of a challenge. Now, you asked specifically about, whether India is prepared to take this on, and what about the people who don't have access to healthcare. It is true, 80% of health spending is out of pocket in India. Much of it is delivered in the private sector. And the average Indian does not go to a doctor if they are sick. They go to an unqualified medical practitioner, or also called a rural medical practitioner. These are the folks who are in the villages right there with them. They might charge them based on an outcome rather than based on just going on per visit. And there are 3 million such medical practitioners, quote unquote, compared to 600,000 medical doctors.
May I just interject here? The World Health Organization expects 1 doctor for 1,000 people. That's the average they've given out. Whereas in India, you have 1 for every 1,674 people. So we have a shortage of doctors. And at the same time, the reports in India say that we have an estimated 840,000 doctors, which really, if you compare with the sheer size of the Indian population, which is 1/6 of humanity. Yeah. So we are short of doctors. I'm not an apologist for the absence of doctors, but the fact is that could that be a reason, or it is just that there is a mental block against seeing professional doctors as against somebody who provides you comfort level in your village?
So the ratio that you point out, 1 per 1,600, actually hides the fact that more than 3/4 of the doctors are in the urban areas. Right. So the urban concentration might be 1 in 600, but the rural concentration in many parts of India might be 1 in 50,000.
Oh, right.
1 in 50,000. So you're using an average number. The heterogeneity there is enormous. Now, it is not that there's a comfort to just seeing the person next to you. Certainly all care is best done by someone that is next to you. But I happened to be out in Nuh in Haryana just, about 10 days ago. And Nuh is only 1 hour from Delhi. The closest MBBS doctor from the village that I was in was 18 kilometers away. In the village that was in, there were 5 rural medical practitioners. So it's just a matter of convenience. I mean, this is where you would go. Would someone go for 2 days to go see a doctor 18 kilometers away? That's how long it would take to get there and come back. But coming back to the pandemic question, if someone showed up with a fever of unexplained cause, maybe it's a new bacteria or virus that has emerged from animals that is close to them, maybe someone has brought it in from another country, the time it would take before that was actually diagnosed as a new disease would be forever, because that person is not going to see a qualified doctor who can actually diagnose this as such, perhaps for days, maybe not even weeks. And our best estimates of being able to control, say, human-to-human transmission of pandemic influenza requires that we know the first case of human-to-human transmission within 2 weeks of it first occurring. The chance of that happening in India is pretty close to 0 right now if it happens in a rural area.
Okay. So all very, very alarming figures. But Colonel Sehgal, more specifically, India, on the other hand, has shown that it's ranked amongst the top 20 countries in the world in terms of private spending on medical health care. And this figure has been going up steadily. So more and more people are resorting to private health care. Apart from the fact that government health care is just overburdened or stretched, what else do you attribute to this increase in spending in private healthcare?
So, Raman brought out that we have skewed percentages of spend in terms of rural and in terms of urban population. However, this the facilities which the government is providing us, and this budget may change that, as you said in the introduction, are woefully inadequate. And I think the comfort level which a patient gets while visiting a private doctor is just not there in the government facilities which are being provided, and that, I guess, is increasing the spending in the private spending which is there in our country. And I think that's probably one of the most important reasons.
Okay, back to you, because I mean you've done a lot of research on some of these things. Now let's look at infectious diseases, or let's just look at the spread of certain diseases which occur with alarming frequency every year. Dengue, or dengue as people refer to it, has a substantial economic burden that it places on the Indian economy, because vast number of people suddenly get affected, and this affects their work pattern, man hours, and all sorts of things. And again, it has shown that most households bear 80% of the costs related to the treatment process of such diseases. What's your view?
Well, it is what it is. I mean, these are diseases that cannot be controlled by an individual. You cannot protect yourself from dengue. It is a civic responsibility to control mosquitoes, and if that is not controlled, then all of us are really at risk. So we are only left with the consequence of it and trying to pay for it. The best option for infectious diseases is prevention. You know, it is done at a mass scale. You cut down dengue and malaria, and those investments need to be made. And unfortunately, that is where the budget spends are not going up at the rate that they really need to. Part of it is driven by the perception that maybe the health sector, the public health sector, is not able to deliver on these sorts of interventions. The move by the government to more go towards private insurance is reflecting a lack of confidence in the public sector to be able to deliver, which is why you also see the the private spends going up commensurately. Now, make no mistake, private insurance does not reduce spending for the out of pocket. It actually ends up increasing spending out of pocket, because why? Someone shows up in a hospital, they go through whatever is, the doctor says they really need. They might have to spend more out of pocket, and we know this from many studies in the US, in India, and many other contexts. So for infectious diseases, there is no real substitute in the long run for water, sanitation, hygiene, vector control. These are where we need a lot more resources. It is health that we need money for, not health care necessarily as a first order of business.
Okay, I go back to the the people who make up our corporate sector, and you've been dealing with them. Now, while they are willing to spend a lot on medical care, how are they, or how do you feel that you would advise companies to protect their employees from infectious diseases or those that come? Because I mean, you're not operating on an island, you're operating within mainland India. So if something happens in one part of Delhi, it's going to get to you in another part of Delhi. So how do you prevent it?
Yeah, corporates need to really look at the wellness programs they run for their employees. I think that's a very important aspect of communicating to everyone to look at their health. As we just said that. It's not the health care which is where you need to spend. It's your wellness which probably will so corporates need to focus on that and need to have a clear communication plan, and that I feel all the corporates need to kind of focus on. Having said that, the medical directors and such like people which the corporates do employ need to focus on the advisories which we share with our employees. The good practices and how do we inculcate them into our daily lives and in the community as such. So that aspect of the advisories need to be really picked up by the medical directors and folks and given it to the people.
Okay, so some very important insights there, and we'll be back after a break to look at issues regarding not just healthcare but wellness, but also equally importantly is how we can overall create an environment in the country for the average Indian, and especially those who impact directly on our economy, to be in better health, so that the impact on the economy is decreased due to illnesses and infection. But that after a break. Welcome back. We continue to have our two experts, and we're looking at the subject of pandemics and its impact on businesses and the Indian economy. So question straight to you. What are the risks that they pose to businesses and the economy? I mean, on the face of it, the one thing that appears is that human resources are vulnerable, and therefore their vulnerability depends at what level it creates an impact, could obviously impact on the performance of companies and the economy, as well as the scare of such pandemics can become a negative aspect for tourism, a negative aspect for investors from outside, that, why go to India? I mean, you'll fall sick.
There are multiple ways in which one can examine that. If you look at what happened at Ebola in West Africa, or what actually happened in Gujarat when there was after the Bhuj earthquake, that there was a thought that there might be, bubonic plague. Eventually, it was not clear that it was. Huge reductions in GDP. It, probably shares a few percentage points off of GDP growth. Certainly, travel stops, tourism stops as well. And it takes a long time to recover. We don't need to have deaths in the thousands or tens of thousands for this to happen. Even a few hundred deaths, which are of cause that cannot be explained, are sufficient to set off a scare of that kind. Now, certainly businesses are likely to be affected, both at the very low end in terms of being affected by say tourism stopping and so forth. But larger businesses are also affected. Particularly multinationals are very sensitive to their employees, including expats they might brought from elsewhere, being sick and dying. In a very famous incident, 2 expat employees at a very large aluminum smelter in Mozambique died 15 years ago of malaria. In response to that aluminum company, which is a UK-based company, decided to spray for 20 kilometers around their plant to ensure that never happened again. Because when they bring in expat employees who die, it just means that the cost of insurance to bring in more employees, or the willingness of other people to come in and relocate to India, becomes much greater. Certainly there are risks to us as well, people who live here, but we are living here, and that's pretty much it. But for people to relocate here, they look at India with a significant amount of skepticism about whether it's possible to actually live there. If you look at just something which is non-pandemic, like air pollution in Delhi, that itself has scared away many MNCs from setting up operations in Delhi, because people don't want to have their children be exposed to either dengue or to the air pollution. So I think that businesses should not excessively focus on health insurance as really being a solution to the risk of pandemics or of health. Businesses should really lobby for and argue for better public health, to reduce the risk of dengue, chikungunya, improved infection control in hospitals and so forth. And the reason for this is that if we have good infection control in hospitals, then it doesn't matter what pandemic reaches there, it will not spread that easily. Today I can tell you, for the level of infection control we have in many hospitals, including in this city, which are the better ones, that infection will spread really fast. And that's what we really need to protect against, and no amount of health insurance is going to solve that problem.
Right. Colonel Sehgal, I mean, that's a very comprehensive answer, but I'd go on to another area which again you'd probably be familiar with, because they say that the private sector, and he talked about businesses should lobby for a better environment in the country, and that will obviously create a healthier work environment and a healthier society. But they say that the businesses would counter-argue to say that the private sector is the most vibrant force in the Indian healthcare industry. Top 200 Indian companies spend close to 1,369 crores on healthcare and wellness. Again, if you look at the CSR focus of many of the companies is again on trying to create healthcare infrastructure. So it's the same argument that the businesses often give, that in terms of security, that we are paying our taxes, why can't the government provide us security? But the government's counter argument is that, India is too huge and too many security challenges, and so therefore what existing forces exist, they are stretched. So where do you get the private and the public to meet together to mitigate these risks and to come forward with a more comprehensive approach? So we work not in competition, but we work in conjunction with each other in national interest.
Yeah, corporate spend can never augment what we are lacking at a government level. I mean, we can. Corporate India can only augment, few places where we feel that there needs to be a little more focus, but it definitely cannot augment the shortfall we do have. While I agree that the CSR spends from corporate India is increasing, and almost 1/4 of the CSR spends of companies is in the healthcare sector, but most of it is really used up on either organizing a medical camp or donating it to a hospital and then just forgetting about it. I think that's where corporate India needs to stand up and say that, okay, here's the money on the table, but we are also going to be monitoring this money, how it is spent, and how it is going to ensure that the benefits are more long-term in nature and not just restricted to just organizing a medical camp and just forgetting about it. I think going ahead and monitoring the places where you have spent this money and seeing where it has made a difference and where we have not been able to make a dent, and analyzing all that for future spends is probably what corporate India needs to do.
Okay, probably the last question to you, Mr. Lakshminarayanan. You talked about developed countries, you've talked about developing countries, but one of the things that people who are sort of standing up for the plight that India and Indian citizens face are pointing fingers to the global health scenario and saying that stressed lifestyle, climate change, dietary conditions, and even some of those pandemics that come into India do come in from some kind of a disease or infectious disease that is taking place from outside India's borders. So what are the contingencies do you think that we should regularly be prepared for, and what steps should we take basically in bullet points as a society to be able to actually fortify ourselves against such challenges, which to me come with alarming frequency? I mean, come monsoon, every year we hear about dengue. There's a swine flu happening somewhere else, and we expect it to happen, but fortunately we've not been such great victims of that. So how do we really do the balancing act?
So we don't need bullet points, we need 4 words. The 4 words is strong public health system, and that is what we really need. Now, a strong public health system would ensure that there is vector control, that mosquito transmitted diseases are not as frequent. So it doesn't matter if Zika comes in. Zika is transmitted by the same mosquito that carries dengue. So if you have good vector control for dengue, you don't need to worry about Zika as much, right? So that's good public health. If we have good hospital infection control, it means that we have less antibiotic resistant infections, and we don't have to wait for it to come from the outside. We already have the infections within the country that we need to protect against. If you take the environment, improving air quality, improving water quality, these have enormous benefits. Water quality particularly important because we ingest pesticides, we also ingest bacteria that are harmful. And last but not least, I think what we really need to do is improve this access not just in the cities but also in rural areas, because it is not as if any pandemic or external threat will show up only in the cities. It might show up in any part of India. People from villages go abroad and people come back to those villages as well. So just to wrap this up, I think what we really need is a strong public health system. If we are able to fortify against the threats we have today, that is our best preparation for unknown threats that might happen tomorrow.
Well, very comprehensively put forward, and lots of lessons there for all of us. But at the bottom line is a strong public health care system that India needs. Thank you very much for being with us on the show. We'll be back next week with another episode. Until then, goodbye.